So moving to the we just want to look at an overview lecture on the possible gene mutations that can be able to cause diabetes mellitus. Right. Possible gene mutations that can be able to cause diabetes mellitus. So that's basically like insulin gene mutation. Sorry. Okay. So what could be the things that could actually go wrong with insulin genetically that can actually lead to diabetes mellitus? So we said that insulin gene mutations can usually lead to what? Different types of diabetes mellitus. Okay. So particularly monogenic diabetes, right? So monogenic one, this one is monogenic, that's mono is one, genic is gene. So like there's single gene mutation affecting insulin production. So these mutations can disrupt insulin synthesis, all right, how insulin is folding and how insulin is being secreted into the body. So the most common things they cause is neonatal diabetes mellitus and also the maturity-onset diabetes of the young. Right, so we have them here: neonatal diabetes mellitus, maturity-onset diabetes of the young, then endoplasmic reticulum stress. Those ones are outside insulin, outside diabetes. They can also cause, of course, hyperinsulinemia or hyperproinsulinemia. Okay. So diagnosis and treatment is this. Genetic testing, you want to actually see if there's mutations in the INS gene. Okay, mutations in the INS gene. That should be the insulin gene, right? So it will help you to now know that there's monogenic diabetes, sulfonylurea. So some cases of MODY may cause insulin gene mutations. So they usually respond well to sulfonylurea medication. So sometimes if you are treating diabetes mellitus and it's so responding to sulfonylurea, you might now want to try it. Sometimes it comes in and you do a wrong diagnosis. You can just attribute it to type 1 or type 2, not paying attention to these red types, you understand? So I think basically this is just it for insulin gene mutations, right? I remember that I can also use insulin therapy for treatment.